Sometimes we have patients that come in and they've kept away from the office for a little bit because they are overwhelmed. They sense that there's several things that need to be done. So what I tell them, we go in and we'll take some pictures or maybe some x-rays or both, and we'll figure out the things that they need done. And I always tell them, hey, I'm going to tell you what I see that needs to be addressed. But you know what? It doesn't have to all be done tomorrow. But what I can do is I can kind of say, let's do these things first, and then second, then the third tier. And it may be 2 or 3 years before we finish and we get you back to maintenance, but we can do it a little at a time. And I grew up in a blue-collar family. I do realize that when I'm fixing your things, I'm spending your money, but I want to be a good steward of your dental dollars. So I'll tell you, what we can spend and how we can spend it the best way so that we don't get into things like root canals or losing teeth. So we focus on the most necessary thing first, and then we go backwards.